So abiraterone it was approved initially in the post-chemotherapy state. And abiraterone and prednisone were compared to prednisone alone. It showed a survival benefit. So of course the thought was to move this drug up earlier in the pre-docetaxel state to see if that also improves survival and effectively make this a treatment option prior to docetaxel. So initially the trial was closed early because the Data Safety Monitoring Committee found that the co-primary endpoint, time to progression, was met. This was the first time that the FDA permitted a drug to be approved by them with a progression-free survival endpoint. That's because you have an overall survival endpoint that was met in the second line. So there was no significant difference in survival, but the criteria for survival were more stringent. You had to cross something called the O'Brien-Fleming line, which is the fact that you're having multiple looks at data, and you have to have a stronger association with survival to meet the criteria. So the final analysis, which was presented by Dr. Charles Ryan this past fall at the ESMO meeting, showed that criteria was met, and there is an improvement in survival in the pre-chemotherapy patients. Now, interestingly, at the time that the Data Safety and Monitoring Committee first said that there was a progression-free survival benefit, all patients were unblinded and received abiraterone if they were on the placebo arm. So this just makes the data that much more significant, I think. So the early use of abiraterone is indicated. I generally will use a hormonal agent such as abiraterone or enzalutamide prior to starting docetaxel. Using prednisone in patients who are being treated with abiraterone. Obviously, if we could avoid using prednisone, we would like to do so. But this is a low dose. It's 5 milligrams BID. You generally don't see changes in blood sugars with this lower level. It's generally fairly well managed. So I don't think using prednisone in this situation is all that much of an issue. It does become a problem over time. And the problem comes from those patients being treated with enzalutamide. There's some data that suggests that prednisone may actually be a poor prognostic factor in those patients who are treated with enzalutamide. So all of these drugs have different effects at different times on the androgen receptor and the prostate cancer cells. So this is why we have to consider not only the treatments that they've received at a given time, but also the treatments they may be receiving previously.